Many years back, I went to Darjeeling. What a memorable trip that was. North Bengal has always enthralled me. And the train journey was so good. But the real hero of that Darjeeling trip was another tourist like me. We met Deepak and his family during a cold morning watching sunrise. He was a history teacher from Rajasthan. When we got introduced, he asked me a lot of things about my profession and what do I do. He was really curious. That day I must have told him few things about ovarian cancer amongst other things. We exchanged numbers. I came back to Kolkata and went to my workplace. And of course, I forgot what I told him. I must confess today that even Deepak faded from my memory. Sorry, Deepak. About 6 years after that, I was astonished to receive a message from Deepak. He wrote that his mother in law was diagnosed to have ovarian cancer recently. He was so thankful that apparently the little information I shared with him that day in Darjeeling helped him a lot in arranging her treatment. She is well now. I was speechless. I could never imagine if those little words could bring colors to someone's life. I learnt a lesson that day that nothing is unimportant in life. Many moons have gone past, but let me recollect today what I said to him that day, hopefully in a little more organized way. This video is to celebrate my friendship with Deepak. What to do if someone has got symptoms of ovarian cancer? The doctors who deal with ovarian cancers mainly are known as gynecological oncologists. Now, these are the doctors are very difficult to find because there are not many gynecological oncologists around. So, if you are in doubt, always go to your own doctor to explain your problems, and you can always request to get an ultrasound scan done and a special blood test known as CA125. Now, I'm not giving you the shortcuts to diagnose ovarian cancer, but these tests can be very useful. The most important thing is to remember that if you are in doubt, please do have a check. Now, in spite of these tests, if they come back as normal, in spite of that, if you have got any doubt, please do persevere. Please do chase the diagnosis. If these reports are all right, then chances of having ovarian cancer are very small. The golden rule is that if you are in doubt, always check. Not all the causes are proved. Science is still trying to understand the causes of ovarian cancers. There can be many causes. Whenever egg comes out of the ovary, it injures the skin of the ovary. It is possible when ovaries are kicked to make more and more eggs, it may give rise to more injuries and more chance of developing tumors. Being overweight, smoking, lack of exercise can also be the causes of ovarian malignancy. A common gynecological condition known as endometriosis can also be responsible for ovarian cancer. Hormone replacement therapy supplements after menopause may increase the risk of ovarian cancer. Sometimes ovarian cancer can also run in families. In these cases, we can find breast and ovarian cancers in multiple members of the family. The actual diagnosis of any cancer and ovarian cancer happens under microscope. So this is called a biopsy. If the ovarian cancer is diagnosed from the water accumulated inside the abdomen, from the floating cells of the water accumulated inside the abdomen, this is known as cytology, which is brother of biopsy report. Now, here is something very important for you to remember. Before final diagnosis, sometimes imagings like pictures of the abdomen like CT scan or MRI scan can be a very valuable tool before the biopsy is undertaken to have a better understanding about the spread of the disease. If the doctor suspects that the cancer or the ovarian cancer is confined within the ovary, then the biopsy is not usually taken by the needle test. It is usually done during the surgery. Now, of course, if the cancer has already spread throughout the abdomen, which can be in many cases, then a needle biopsy can be very valuable actually. So there are different roles when to do a needle biopsy and when not to do a needle biopsy test. This is an important thing for you to remember. Ovarian cancers are treated with a combination of surgery and chemotherapy. In most of the cases, surgery is the primary choice. Most ovarian cancers will need chemotherapy even after surgery. Apart from that, good nutrition, exercise, and good lifestyle, these are also very important as a treatment for ovarian cancer. These individually will not help ovarian cancer, but these form a very important basis along with the surgery and chemotherapy together. There has been serious advances in the management of ovarian cancer surgery. The aim of the surgery is to remove all ovarian cancer tumors and other gynecological organs as well. There are two distinct philosophies of these surgeries. Staging surgery is where aim of the surgery is to check the spread of the disease and decide the need for chemotherapy. Cytoreduction surgery for ovarian cancer, on the other hand, tries to reduce the tumor bulk of the ovarian cancer and reduces the chances of drug-resistant ovarian cancers. Often, both staging and cytoreduction surgery may overlap with each other. Chemotherapy is usually done in collaboration with surgery. When used after surgery, it is called adjuvant chemo. When it is used before the surgery, it is called a neoadjuvant chemo. There are many chemo medicines for ovarian cancer. However, a platinum drug is the backbone of ovarian cancer chemo treatment. Platinum is crucial. If an ovarian cancer stops responding to platinum chemotherapy, then it becomes a challenge for women with ovarian cancer. Ovarian cancer management has drastically changed over the last decade or so. The type of surgery has changed a lot. The sequence of chemotherapy and the choice of chemotherapy agents has changed a lot as well. There are new chemotherapies and targeted therapies that are coming in. We also see a role of genetic medications. That is also very important. At some point in time, we will discuss about those things in detail, but not today. Overall, the ovarian cancer treatment is very important because of a particular aspect of it. In many diseases, the treatment is typical between one patient to another, and it does not vary between one patient to another patient. But for ovarian cancers, the treatment has to be tailor-made. The sequencing of surgery and chemotherapy, surgery first or chemo first, or when it will happen, and those kind of things, and what chemo and what time and all those kind of things. That means the individualization of the treatment is very important. It is often called a tailor-made ovarian cancer treatment. So these are the few important advances we had in ovarian cancer. And with these together, you and us, I'm sure that in future as well, we will be able to treat ovarian cancer patients in a much better way. You have learned today a lot about ovarian cancers, the information so far which has been hidden in medical books sometimes. I'm sure that this will help you and people around you to save lives. That's all today. Have a good time.